What I'm really interested in is the experience of workers and the role of labour in society, which often gets forgotten about. When, of course, COVID-19 came along, I was very interested to see how that impacted on people working. The overall British Academy programme was looking at vaccine hesitancy, and we thought it was very important to look at how frontline workers who had been exposed throughout felt about getting vaccinated.
Shot scratch.
Particularly as they were disproportionately black and minority ethnic workers.
My area of research is frontline workers that are working in precarious work and their links to community groups and community organisations, such as this organisation here that's running this food bank. This was set up right at the beginning of the first lockdown. A lot of people in the community, a lot of part-time workers, frontline workers on 0 hours contracts were kind of losing their jobs, not having work because of the lockdown restrictions and obviously the impact of COVID-19.
I teach marketing at University of Southern Maine in Portland, Maine. I create models to predict buyers or consumers' attitude. What actually excited me at the beginning was that I used the models that we have in business, in marketing, and applied this model to the field of healthcare. At the beginning of the pandemic, many of the frontline workers and many of these people are Black, Indigenous people of color. They felt like they were not protected by their employer.
It was only after the death of two colleagues at the beginning that they started to give us the PPE and what we are asking for.
People have felt that they were not only pushed towards the front line, but a lot of our people did lose their lives.
We found in both places that there were frontline workers who often, because of the contracts they were on, they had limited access to health insurance or sick pay.
So you have a situation, a dilemma where the work environment is not safe. And if they're infected, forced to stay home. And you know exactly what forced to stay home means. That means there is no paycheck.
And it literally for them was a decision about, do I go into work and put myself at risk, or do I stay at home and I can't feed my family? People often felt they've been exposed to it so much that what difference would a vaccine make, and why should they get vaccinated when they felt that they had not been valued for their work throughout the pandemic.
People were also talking about treatment and access and health equity in the present as a way of explaining their lack of trust in the healthcare system, but also as well in terms of their lack of trust of government officials as well, that were telling communities and individuals, go and get your vaccine.
It's quite clear that in both cities it was the community that stepped in and mediated vaccination and addressed vaccine hesitancy. And we're here in a community centre today which actually did that.
The local NHS, the local public health realised that they needed to do better community outreach, much more culturally appropriate, working more closely with faith communities, faith networks, with community groups, informing public health messages around the vaccine.
When we started hearing about this vaccine, somebody had to really stand out and try and take the lead. So I was one of the first people within my community to take the vaccine. After putting the picture on Facebook, I got a call from my mom to ask me if I was still potent, because of the stories they were hearing. I said, Mom, you got your grandchildren already. Why are you asking that question?
So we know now what can come from a pandemic that could potentially influence people's attitude to accept to be vaccinated or to refuse to be vaccinated. It's trust, it's risk, it's safety, it's social environment. For the next pandemic, we need to prepare ourselves to make sure that we don't get into the same issue.
I've been really struck by the lack of focus on work and the workplace as part of general policy, and particularly in this case public health policy. I think what we've seen through the experience of frontline workers is that it is actually really important, and we need to restore that focus on work and well-being at work to public health, but to public policy more generally.